This patient was dying, but she never knew. She thought everything was okay. In fact, she walked in to the hospital smiling and the rest. In fact, it was really surprising that just within 24 hours, still within the day, we're battling to save her life. Hello everyone. In this video, I'll be sharing certain tips that when we notice, we shouldn't take for granted because they could be a pointer to something that can save your life. This is Registered Nurse Miracle, and in this channel we share vital informations and health tips that can help you stay healthier, stronger, and save a life. So that patient, like I was saying, she complained she had headaches, but she has been, people abuse these drugs a lot, paracetamol. Now, some of them I've noticed as a nurse, I noticed some of them now take what they call, there's a brand they call that is a mixture that is containing diclofenac and the rest and so on. They just, they say when I take it, it helps me relax and the rest. All those things, consistent use of them. That's why if you have ever looked behind a paracetamol tablet or a drug, let's say, they give you a duration. First of all, you're not supposed to take that drug when your condition is not well diagnosed. Yes, it should not just be a go-to thing like, hey, please give me, hey, nurse, I beg, give me. No, it shouldn't be like that. It should be proper diagnosis before medications. Remember, drugs are poisons. So if you just hop on them as if you are taking food, you are harming your body. Slowly, you're harming your body. So now, she had this persistent headache and has been on, paracetamol, and normally the instruction is if you take it for 3 days and the symptom persists, that is, you still keep having these headaches and the rest, you should see a doctor. So she ignored it and just continued like that and like that until that day, as God will have it, she was on a trip to visit someone, not knowing that her health too was at stake. So she just stopped by. I'm like, nurse, check my BPA. Okay, like a joke, we just checked and it was quite high. When you start having readings of 200, and that's really close to a stroke. And those kind of things are medical emergencies. So please, I would advise that if you notice severe headaches that is consistent. I know a patient complained some time ago that the headache is said somewhere at the back. She was pointing at this back where we refer to as the occiput, that she usually have severe headaches there. And that's because she is hypertensive and she has been on drugs. To her, that tells her that it's time to take your drug. Although it's not advised that you wait till symptoms happen before you take your drugs. You should take your drugs to prevent the symptom from happening. Because I was trying to explain to one of my patients, and I tried to explain to her that, do you understand the mechanism around these headaches? Why do you have headaches related to your blood pressure when it goes high? Now, I explained to her, and you need to learn this. The vessels, blood vessels that carries blood to the brain are a little smaller, a little narrow. So when there is a force, like an increase in pressure from the blood pumping from the heart, it tries to, and those vessels are not, they have their elastic limit. It tries to force it, by force. You are trying to push. Just imagine a very tiny rope. You are trying to force a large amount of fluid through it. It will try to expand. It may not go, something may just not go right. So that's what happened in the blood vessel. That pressure is there. That pressure on that tiny blood vessel connecting to the brain, when it intensifies, it causes that headache as a sign. When it becomes bad is when it ruptures. After the pressure becomes so much, it ruptures, a part of those blood vessels ruptures, and there's bleeding in the brain. And by then, symptoms begin to show. People begin to have what they call stroke. because that part now, blood is no longer supplied there, so that part of the brain is not functioning as it should, and before you know, stroke. The person can't lift the hands, a particular part of the body, and the rest. And I'm very sure you don't wish that for yourself or anybody connected to you, even your enemies. Severe headaches is one of the signs. Sometimes blood vision, another vital organ we experience this effect of high blood pressure, is the eyes. The vessels carrying blood to the eyes too are very sensitive and narrow. So if the pressure is high, it will, just imagine pumping a tire by with too much air. That tire can just burst and explode. And that's why they have a measurement gauge, right? So that's the thing. The pressure is so much, you begin to see blood like as if you are seeing cloudy. Your eyes, some people say my eyes is turning me. That is another sign. Dizziness, you feel dizzy, like you want to sleep and the rest. It's necessary that when you notice these signs, headache, blood vision, dizziness, please check your BP. You can ask someone around you, help me check my BP, my blood pressure. The machine, if you have a personal one, it will be very helpful, especially if you notice the signs as you are getting older, that you are noticing these signs coming up. It's good you have a personal one that you will just press and it will give you the reading. Digital one, you just read, it's easier to use. But if you don't have and you can go out to meet someone, necessary you go meet a medical personnel. Like for that patient, after checking, we couldn't let her go that way because it was a disaster, and you know that was her life at stake. We had to give her a medication to help manage it immediately. Thank you so much. If you enjoyed what you're watching, please subscribe to this channel and encourage us to share more through your comments and your likes and the rest. Share to friends and the rest. Please, a simple headache may be a pointer to a condition. Do not ignore it. Thank you.